So the legal requirements. Obviously the patient's name and address, and that's actually a legal requirement. The prescriber should write in black ink, not in any other colour or pencil or anything else, or it can be electronically generated as well in ink. The practice address of the person prescribing and the address of the prescriber, so it may be the trust addresses on there and contact number, but also a contact number for the prescriber, so if the pharmacist has a query they can get straight through to the prescriber as well. So there's usually a place, particularly on an FP10, for that, but you'll have to look at other drug charts, etc., to find what the particular way of completing these are to meet these legal requirements. It should be clear what capacity that person's prescribing in. So for example, on an FP10 at the top, before you actually write the drugs in, it will say on an independent and supplementary prescriber's pad, it will say independent / supplementary prescriber. And it's good practice to cross through which capacity you're not prescribing in. So for example, if you're prescribing independently, cross out supplementary and vice versa. And for allied health professionals, obviously, they'll be prescribing as a supplementary prescriber. So it's clear to the pharmacist when they see this prescription, they know that it's a nurse or a midwife or a physiotherapist, for example, and they can think, oh, can they prescribe this drug in this capacity, etc. It just gives them a help, and it also makes it very clear in terms of checking. And if you're working in a hospital situation, you may have a stamp with your own information on it. You need to find out locally what the requirements are for where you're working for your prescription writing. The date must always be on there, the date that the prescription was written, or the intended date. Sometimes you may be writing a post-dated prescription. For example, if a patient presents with an infection which you're not sure if it's bacterial or viral, and you advise them about it being a viral infection, but you may feel that if in 2 days' time things get worse, they can then cash in a prescription. So there is sometimes a need for a post-dated prescription which a patient can cash in if the condition deteriorates and becomes a bacterial infection. They need that antibiotic. So sometimes they can be post-dated by a couple of days. So information on whoever the independent prescriber is or the supplementary prescriber. So for example, if it's a nurse prescriber, their NMC PIN number will be printed on there, their name will be printed on there. If it's in a hospital, sometimes a hospital may provide you with a stamp with those details, so you stamp those onto your prescriptions as you go, or you may have to fill it in yourself. If the patient is under 12 years of age, it's a legal requirement that both the date of birth and the age is on the prescription. And it may surprise you that it's not a legal requirement for anyone over the age of 12 to have the date of birth on the prescription. But I think this is one of the areas where it becomes good practice. It helps the pharmacist know in terms of the elderly, the age of the patient that you're prescribing for. It just adds a safety check in. So I think it's good practice to always put the age and date of birth for your patient on all prescriptions. If you're writing for a controlled drug, there are additional requirements, so you need to look at the BNF for those. I'm not going to cover it at this moment. If you're writing a prescription by hand, you need to ensure that no one can write anything else after you've written your prescription. So there's certain things you can do to prevent anyone writing additional items after your prescription. So for example, putting a zigzag through the space and crosses, or you could write the words "no other items" on this prescription. If you're generating an electronic prescription, that normally is an automatic feature that there's a series of X's to fill in the blank space. And the pharmacist will know then if someone writes over those zigzags, or after you've written no more items, or after the crosses, that's someone trying to obtain a product by fraud. And I can assure you this does work, because I have heard of examples in practice where someone was trying to obtain Zopiclone on a prescription that a nurse prescriber nurse practitioner wrote, and she put the zigzag through her prescription and was alerted by the pharmacist that the patient had written Zopiclone across the zigzag, and that patient ended up being arrested, and they were undertaken community service and a fine as a consequence of trying to obtain drugs illegally. So it does work. Once you write a prescription, it's valid for 6 months from the date of you writing it. If it's for a controlled drug, it's only valid for 28 days. That's something to be aware of. When you're writing any drug in a hospital situation, even if it's a GSL, that's to remind you that's what you can buy from a supermarket or garage, for example. Paracetamol 500 milligrams, for example, or it might be infant Nurofen, whatever it may be. Or if it's something that would be a pharmacy medicine, which you'd ask for the pharmacist over the counter, but the virtue of the fact you're in hospital, all drugs become de facto prescription-only medicines because they're prescribed in hospital. Even though it's something someone could obtain themselves in a variety of outlets, it is still a prescription-only medicine because it's prescribed in a hospital situation. So, we've mentioned what was the law in terms of writing prescription. Now, what is good practice? Well, they should be written legibly, and I think you'll find that's actually recommended quite high up in the BNF about writing prescriptions. So it's actually, if it's not legible, it's not legal. It's not able to be safely dispensed. So it's good practice as well as a legal requirement to write legibly. We've said that you don't have to write the date of birth except if it's a child under 12, and then you have to put the age as well. The dosage instructions must be clear, obviously get the correct spelling of the drug as well, and the frequency, that must be written on there as well, and the formulation, so whether it's tablets, whether it's capsules, whether it's liquid, suppositories and so on and so forth. And the quantity is a must. Sometimes if you're on an FP10 you may write at the top part of the prescription the amount of days to be dispensed, or you may write the total amount, say for example 28 days, or the total amount of tablets, so you calculate how many tablets for a 3 times a day dose for 5 days, for example, and you write the total amount in brackets after the name and dosage, etc. I find many of my students leave the route off of their prescription, which they say, well, I've written tablets, it's obvious it's going to be oral. Well, I think it's just good practice and just an extra safety check if you write the route. So there's no margin of error or confusion. So adding the route in is good practice as well. So must-dos with prescription writing. Look at the BNF, look at the Department of Health as well about prescription writing. Make sure you comply with what you must do. And it's very clear in the BNF exactly what you must do. Be clear in your mind what is a legal requirement and what's good practice, and decide, think of the implications of not complying, particularly with the good practice elements as well. Think about writing a prescription, think about distractions, think about when you're in a busy or a heated or an urgent situation or a chaotic situation, maybe on the ward the phone's ringing, or you may be in someone's home and your phone's ringing and the patient's trying to talk to you at the same time and you're trying to do 6 things at the same time. You must, for your own professional peace of mind, concentrate carefully when you write a prescription. Never feel frightened to get your BNF out in front of a patient. A lot of my students feel that it shows that they don't know what they're doing, or that it shows that they're new to the job of prescribing. And I say it's actually a brilliant opportunity to reassure the patient that you're being thorough And you may want to share some of the information in the BNF to show the patient being transparent, open and honest, having a concordant consultation rather than it being a one-sided nurse or doctor or AHP knows best situation. You're truly embracing a partnership approach to your prescribing, and the BNF can help you do that, as well as giving you peace of mind that you've looked for the best product, you're aware of the indications, etc., and you've got the dose right. Another can do, you don't have to do this, it's just something you might like to consider, is using cautionary and advisory labels. There's a whole list of them in the very end of the BNF. For example, labels 29 and 30, do not take more than 2 at a time and more than 8 in 24 hours. So you might want to put that on an ibuprofen prescription, for example, or do not take with any other paracetamol products. So you're prescribing paracetamol or something that contains paracetamol, cocodamol, for example, and you want to ensure that they know that if they're buying something over the counter at the same time, they've got to be aware of paracetamol. So these labels do that extra bit for you, and all you need to write is cautionary label or advisory label and the number, and the pharmacist will add that on to the packaging. Sometimes they do that automatically. If you want to be absolutely certain that that's what you want on there, so you're really clear. It may be someone who can get a bit muddled, or you feel that they're very distracted, and you haven't maybe taken all the information in, that you want to be clear when they get hold of that pack of drugs, liquid, whatever it might be, they've got that extra information to remind them about what you've said, and that they're going to be safer with the administration of what you've prescribed. If you don't want to use an advisory label, one that you would normally be on there, you need to annotate the prescription to that effect. And if you look in the section on advisory labels or look at the BNF online, it does tell you about that for the rationale why you don't want to use a label that would normally be put on automatically. You need to then provide the alternative wording, and it may be something very unusual, but you may have a good rationale why you don't want a particular label to be used and you want a different wording to be used for a particular patient or indication. We mentioned quite a few times the word accountability and responsibility, and it can't be stressed enough. If you're prescribing in an independent capacity and a supplementary capacity, you need to be certain that you are supported by your employer for vicarious liability. So it must be on your contract of employment that you're able to prescribe in either of those capacities. You've also got to remember your professional accountability for whichever professional body you're aligned to, that you are working within your code of conduct and ethics as well.